About 45% of adults snore occasionally and 25% do it chronically. It's the punchline of countless jokes, but have you ever wondered what is actually happening? And more importantly, how do we actually fix it? Snoring is a noise generated by turbulent airflow in a narrowed upper airway during sleep, typically at the level of soft palate, uvula, tongue, and pharyngeal walls. Snoring happens when the airflow through the mouth or nose is partially blocked during sleep, causing surrounding soft tissues to vibrate and produce sound. As muscles relax in the deeper sleep, these tissues can sag in the airway, so each breath sets them vibrating like a loose flap in a pipe. Airway anatomy could be a common contributing factor, like long, soft palate or uvula, narrow airway, enlarged tonsils or adenoids, thick neck, or deviated septum, all reduce airway caliber and promote vibration. Sometimes sleep-related natural muscle relaxation can be a contributing factor. The muscle relaxation can further be enhanced by alcohol, sedatives, or some medications, which lets the tongue and throat collapse into the airway. Nasal obstruction like allergies, cold, sinus infections, nasal polyps, and structural issues like deviated septum push people toward more mouth breathing and increase snoring. Weight gain and age trigger extra adipose tissue around the neck, and progressive tissue laxity with age both narrow and destabilize the airway, making snoring more likely and often louder. Last but not the least, sleep position can be a contributing factor. Supine sleep allows the tongue and soft palate to fall backward, narrowing the airway more than side sleeping does. Benign occasional snoring is common and often just a nuisance, but frequent loud snoring can signal obstructive sleep apnea. Obstructive sleep apnea involves repeated airway collapse and pauses in breathing, often accompanied by gasp, choking, morning headaches, dry mouth, or daytime sleepiness, and is linked to hypertension, cardiovascular disease, stroke, and metabolic issues. Evidence-based first-line strategies include weight reduction if overweight, avoiding alcohol and sedatives before bed, and treating nasal allergies or congestion to improve airflow. Positional therapy like encouraging side sleeping along with medical evaluation for persistent snoring helps identify obstructive sleep apnea or structural issues that may require CPAP or oral appliances or sometimes even surgery. In next video, let's analyze some over-the-counter products, the evidence behind the over-the-counter products. So continue watching. See you in the next video.